Well, you just heard there Minneapolis Police Chief Brian O'Hara giving a heartbreaking press conference after a mass shooting this morning at Annunciation Roman Catholic Church. Here's what we know. Now, according to Minneapolis Mayor Jacob Frey, children have been killed. 2 young children aged 8 and 10 were killed as they sat in the pews of the church. Other children were injured, 2 of them in critical condition. According to law enforcement, in total, 17 injured. The shooter, armed with a rifle, a shotgun, and a pistol, targeted children through the church windows. There were dozens of children inside the church. The shooter also carried what police describe as some sort of smoke bomb. The shooter, law enforcement believes, took his own life after firing dozens of rounds. Hello, everyone. This is Outnumbered. I'm Emily Campagno, and also joining us today, Sandra Smith, co-anchor of America Reports, Rachel Campos Duffy, Fox and Friends Weekend and Fox Noticias anchor host, Lisa Booth, Fox News political analyst, and Trey Gowdy, host of Sunday Night in America. Trey, I want to go through some of the details that we just learned from this press conference. As I mentioned, heartbreaking from the police chief there as he describes what they believe as a sole shooter, now deceased in his early 20s, who in the morning at 8:30 a.m. arrived to Annunciation Roman Catholic Church, approached on the outside side of the building and began firing, they believe, all 3 weapons of a rifle, a pistol, and a shotgun. The police chief saying the sheer cruelty and cowardice of firing into a church with children is incomprehensible. With law enforcement immediately responding, we now know that 2 children lost their lives, with 14 injured and 3 other adults injured, 2 of them critical. We know that law enforcement responded immediately. It is unsure yet whether the shooter indeed fired rounds inside the church. They have yet to find casings inside. There's a lot of questions unanswered at this point. Trey, with your vast experience as a federal prosecutor and serving in Congress, what are your thoughts today as we witness this tragedy unfold?
It is the softest of all targets. I mean, it literally rolls out the welcome mat for troubled people. It is the place for troubled people to go. So it is the softest of all targets and the most innocent of all victims, children. And so there are no words for the parents whose children were killed today or injured. And make no mistake, even those that survived will be impacted for the remainder of their lives. And this is more church or school shootings than the 5 of us can count. And so we do have to have a conversation about protecting soft targets, especially schools and churches where literally the whole purpose of the church is to welcome people who are down and out, who are depressed, who feel ostracized. That is the purpose of church. Having said that, there are no words. The only thing that can give us any modicum of peace at all is those 2 children are with the person who loved them the very most, the person who created them, that being Jesus. That is the only thing that can possibly give parents in the future any modicum of peace, that those children are literally with the person who loved them the very most. Aside from that, I'm glad the shooter is dead. I wish he had taken his life before he took the lives of innocent children.
And more on this heartbreaking tragedy. We'll bring in Bill Malugin, who is live with more. Bill.
Yeah, Emily, one of the biggest things that jumped out to me from that press conference is what the mayor said. He said these kids were literally praying when this happened. And then we heard the police chief say that the 2 victims, an 8-year-old child and a 10-year-old child, both died sitting in the pews as they were praying. Just horrible. We got more clarity on the numbers. Those 2 children passed away, 17 others injured, 14 of which are children, and 2 of those children in critical condition. And then they gave us some more details on how this happened. It doesn't sound like he physically got into the church and fired in there. It sounds like he was out in the parking lot, pulled out a rifle, and then just started spraying through the windows at dozens of children inside who, again, were all praying. The Annunciation Church, it's the first week of school. It's a Catholic church. It all happened at 8:30 in the morning, but police saying pretty much all the shell casings they found were outside in the parking lot. They say he may have gone inside the church at some point. They mentioned something about he went around to one side of the church and it was barricaded, potentially with a 2x4. We're going to have to get more details on that, but it sounds like at some point, maybe in between the firing, he went up to that church and there were people inside who tried to stop him from getting inside. But just think about it, guys. All these young children, we're talking elementary age school kids, sitting in church. It's quiet in there. They're praying. They have no idea what's outside. They're not looking out the windows, most likely. And then all of a sudden, from what we've heard with the witnesses, it was just boom, 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 dozens of gunshots, rifle rounds coming through the windows. And again, the horrible news that children have died as a result of this, 8 and 10 years old. We'll send it back to you.
Incident.
For a moment as now, we are listening to the hospital press conference live.
This morning, that gave us time to mobilize all of our resources and prepare our teams. We are a level 1 trauma center, and we prepare and we train for this. Having said that these incidents are never easy. We've had 2 in the last 24 hours that have occurred, these mass casualty incidents. The one today, we received a total of 11 patients from this incident. 2 of them were adult patients, 9 pediatric patients. 4 of them required the operating room. And up to this point in time, there have been no fatalities related to any of those patients that were brought to our organization. I want to take a moment to tell you how proud I am to work for this organization and the teams that were involved, the resources, again, that were mobilized, our surgical colleagues, our medicine colleagues, our amazing nursing staff, our psychologists that help process these events for us, environmental services, all those involved. Hennepin EMS brought in all the critical patients from that scene to our organization, and we were very lucky to have 2 emergency medicine, emergency medical services directors that were on scene and able to provide us with really important information that, again, helped us to prepare for this event. So I don't have any individual or specific information about the patients at this time for you, so that's all I can share. Thank you for being here. Any questions?
You said they were in critical condition?
7 were brought in as critical patients, and at this time, I don't know the updates on what the conditions are of many of them. 4 of them required the operating room, as I said.
That there was a baby?
There were, again, 9 of the 11 patients were pediatric ages. Can't remember the exact ages. I believe it's 6 all the way up to 14. That's the range.
Can you tell us a little bit about what types of teams you had working this morning, how many people it takes to treat a scene like that?
Yeah, whenever that type of a page goes out, again, it really puts into motion a lot of a big response from all of the teams. And so because we're a level 1 trauma center, we have to, mobilize certain types of resources like, operating rooms and the surgical services. We have to have emergency providers and nurses. We have to, mobilize things like the laboratory and the blood bank. So there's a lot of planning, and again, a lot of exercises we do throughout the year to prepare for these events. And unfortunately, we respond to many of them throughout the year.
Can you talk about the injuries at all, or any type of what you're seeing here with some of these patients?
I can't get into specifics, but we are dealing with gunshot wound injuries from apparently a high-velocity weapon. And, gunshot wounds can be very problematic because they can involve multiple body systems. And again, they require a lot of resources to manage. But again, we see a lot of gunshot wounds here at Hennepin Healthcare, and we're among the best in the nation every year at managing penetrating trauma. So we are used to seing them.
Can you tell us where the status of the 11? Are any of them still in surgery?
I don't know the status of it. I can't share that with you at this time.
Was anyone shot more than one?
I can't share that information with you at this time.
Can you confirm the families of some of the victims that made their way here?
Yeah, we've had quite a bit of effort to stand up a reunification center across the street here in our clinical specialty care building. And so to my knowledge, I believe all or almost all of the families and loved ones have been reunited with patients and know their status.
Do you know if anyone is being treated at any other locations?
My understanding was we had a lot of the non-critical patients that went to Children's Hospital, and I believe one went to Masonic Children's Hospital as well. I don't know the status of any of those patients.
Can you speak to the toll it takes on physicians here who have to handle these types of cases and mass handle the case within hours?
Yeah, it does take a toll. Thank you for asking that. Asking that question. I think again, we have psychologists that we have dedicated to our emergency department to help with our providers and our nurses and other workers to manage these types of events. Again, we've had 2 mass casualty events happen in the last 24 hours. I mean, that does take a toll. But we also have to recognize that we are here as a critical resource for our community, and we have to take time to process, the care that we deliver in these situations, and we have to be able to move forward because we are obviously needed.
And none of those patients have been discharged?
Not to my knowledge.
You said there were 11 total, and 9 of them were pediatrics ages 6 to 14, but 7 were in critical condition. Are all of those that are pediatric, those 6 to 14, are all of those in critical condition, or the ones that are older also in critical condition?
I don't want to misspeak here. I believe that all of the pediatric patients were the ones that were in a critical condition. Yes.
Did I get my numbers right? I'm saying that.
You did.
Can you give us your specific title one more time, Doctor?
It's Thomas Wyatt, Chair of Emergency Medicine at Hennepin Healthcare.
Thank you.
Thank you.